Why is healthcare so expensive in the United States? Healthcare in the United States is often described as one of the best in terms of advanced technology, skilled professionals, and cutting-edge treatments. However, it is also one of the most expensive in the world. According to the Centers for Medicare and Medicaid Services, CMS, Americans spent over $4.5 trillion on healthcare in 2022, averaging more than $13,000 per person annually. This number is not only significantly higher than in other developed nations, but it continues to grow faster than inflation and wage increases. Understanding why costs are so high, and what you can do to manage them, is crucial for every American household. One of the biggest cost drivers is the multi-layered insurance system. Unlike many countries with a single-payer or nationalized system, the United States relies on a mix of private insurance, employer-based plans, Medicare, Medicaid, and out-of-pocket payments. This complexity creates administrative overhead. In fact, administrative costs make up roughly 8% of total healthcare spending in the United States, compared to just 1–3% in countries with streamlined systems. Insurance companies negotiate different rates with hospitals, meaning that the same procedure can cost vastly different amounts depending on where you live and what coverage you have. A simple MRI scan can cost $400 in one facility and over $3,000 in another, without a difference in quality. In many countries around the world, healthcare is funded primarily through taxes and provided as a public service available to all residents, regardless of income or employment status. Nations like the United Kingdom, Canada, France, Spain, Brazil, and Australia operate universal healthcare systems, where citizens can access most medical services without paying directly at the point of care. These systems are designed to ensure that no one is denied treatment because they cannot afford it, and while they are not free, being funded through higher taxes, they often result in significantly lower overall healthcare costs for individuals and families. In contrast, the United States does not have a universal healthcare system that covers the entire population. Instead, it operates a mixed model. Public programs like Medicare and Medicaid cover specific groups, seniors, low-income individuals, and certain disabled citizens, while the majority of Americans rely on private health insurance, often provided by employers. This difference means that in the United States, healthcare is closely tied to insurance coverage, and those without adequate insurance may face extremely high out-of-pocket expenses. As a result, medical bills are a leading cause of personal debt in the country, and access to care can vary greatly depending on one's financial situation, employment status, and state of residence, making the United States healthcare landscape very different from most developed nations. Hospital and prescription drug prices are another major factor. The United States does not regulate drug prices at the federal level, allowing pharmaceutical companies to set market-driven prices. This is why medications like insulin, which can cost $10 in Canada, may be over $300 per vial in the United States. Similarly, hospitals often operate like large corporations, with high labor costs, expensive equipment, and aggressive billing practices. Even something as simple as an emergency room visit can cost thousands of dollars, especially if you are out of network. The average hospital stay in the United States now costs over $2,500 per day. When Americans talk about the cost of living, healthcare almost always enters the conversation, and for good reason. The United States spends more on healthcare per person than any other developed country, yet many individuals still face high bills, surprise charges, or medical debt. The reasons are complex, involving a combination of how the healthcare system is structured, the role of insurance companies, the pricing of medical services, and the cost of advanced technology and prescription drugs. Unlike many countries where the government plays a central role in setting or negotiating prices, the United States operates in a largely market-driven system. This means that hospitals, pharmaceutical companies, and insurance providers negotiate prices independently, often leading to large variations in cost for the same procedure. A major factor is the cost of administrative overhead. In the U.S., there's a web of private insurers, public programs like Medicare and Medicaid, and various networks of providers. Each requires its own billing systems, claims processing, and compliance measures. This administrative complexity is expensive, and those costs are passed down to patients in the form of higher premiums, deductibles, and co-pays. Another driver is the high cost of pharmaceuticals. In many cases, drug prices in the United States are significantly higher than in other countries because there are fewer price regulations and longer patent protections, allowing companies to set prices based on what the market will bear rather than production costs. Hospital costs also play a huge role. State-of-the-art medical equipment, advanced surgical techniques, and highly specialized staff contribute to quality care but also drive up costs. In many hospitals, especially in urban centers, there is also a significant amount of cost shifting, where higher charges for privately insured patients help cover the costs of treating uninsured or underinsured patients. And let's not forget the role of defensive medicine, where doctors order extra tests and procedures to protect themselves from potential lawsuits, adding to the bill. But while the system can be overwhelming, there are strategies to protect yourself and lower your expenses. 1. Shop for insurance wisely. Compare not just monthly premiums, but deductibles, co-payments, and out-of-pocket maximums. Sometimes a slightly higher monthly premium can save you thousands if you need care. 2. Use in-network providers. Staying within your insurance network can dramatically reduce your costs. Always verify coverage before scheduling appointments. 3. Ask for cash prices. Even if you have insurance, some providers offer discounts for upfront payments. You can often negotiate lower rates for procedures or lab tests. 4. Use generic drugs. Generics have the same active ingredients as brand name medications but can cost up to 85% less. Ask your doctor if a generic is available. 5. Preventive care. Take advantage of free annual checkups, screenings, and vaccinations covered by most insurance plans. Preventing a condition is far cheaper than treating it later. 6. Leverage urgent care centers. For non-emergency needs, urgent care can be a fraction of the cost of the ER. 7. Use health savings accounts, HSAs, or flexible spending accounts, FSAs. These accounts let you pay for medical expenses with pre-tax dollars, reducing your overall tax burden. It's also worth noting that price transparency laws are changing the game. Since 2021, hospitals have been required to post their standard charges online, although compliance has been inconsistent. In the coming years, more tools may emerge to help patients compare costs like they do for airline tickets or hotel rooms. Websites like Healthcare Bluebook and GoodRx are already giving consumers more negotiating power. The United States healthcare system is unlikely to become inexpensive overnight, but informed decision-making can make a huge difference. By understanding how the system works, shopping smartly for care, and taking preventive health seriously, Americans can better protect themselves financially. Remember, while you may not have control over national healthcare policy, you do have control over the choices you make as a patient. Those choices can save you thousands of dollars, reduce stress, and help you access the care you need without sinking into medical debt. For individuals, navigating this system can be overwhelming. But there are steps Americans can take to better manage their healthcare expenses. First, understanding your insurance plan is critical. Know your deductible, co-pays, and out-of-pocket maximums so you can plan ahead. Second, don't be afraid to shop around for care. The price for the same test or procedure can vary greatly between providers, even within the same city. Many states now require hospitals to post their prices online, giving patients more power to compare. Another smart move is to take advantage of preventive care, which is often fully covered under insurance plans. Regular checkups, screenings, and vaccinations can prevent costly health problems down the road. For prescription drugs, ask your doctor if there are generic or lower-cost alternatives, and compare prices at different pharmacies. Sometimes paying cash can be cheaper than using insurance. You can also use apps and discount programs like GoodRx to save on medication costs. If you're facing a large medical bill, remember that prices are often negotiable. Call the billing department and ask for an itemized statement to ensure there are no errors, and don't hesitate to request a payment plan or financial assistance. Many hospitals have charity care policies, but you have to apply for them. Ultimately, the high cost of healthcare in the US is unlikely to change overnight, but being informed, proactive, and willing to negotiate can significantly reduce your personal financial burden. While systemic reforms may eventually address some of the underlying issues, individual action, from smarter insurance choices to preventive health habits, remains one of the most powerful tools Americans have to protect both their health and their wallets. The economy affects everyone, including you. But do you actually understand it? For example, why do prices keep rising? Why are some countries rich while others stay poor? Why does your paycheck never seem to be enough? What can you do, personally, to change your financial future? This ebook is exactly what you've been looking for. Understanding Economy: How You Can Improve Your Life is an excellent must-read ebook to help you improve your life. What this ebook will teach you: how the global economy actually works. In simple and practical language. The real reasons behind inflation, poverty, inequality, and wealth. The truth about capitalism, socialism, government spending, and taxes. Why some people escape poverty, and how you can too. How to start your own business, manage money wisely, and protect yourself in tough times. Why crime, corruption, and bad leadership destroy a nation's economy, and what honest people must do. Why sustainability matters, and how a strong economy can exist with a healthy planet. The secrets behind economy, cost of living, interest rates, and personal wealth building. How to take control of your financial life, no matter where you start from. And much more. Many people are buying this ebook to better understand how the economy works, and thus improving their lives. This is not a boring academic textbook full of formulas. It's a practical guide written by someone who believes that economic knowledge can empower everyday people. This ebook has about 480 pages, explained in a simple way so that everyone can understand economics. This ebook is perfect for you. Can you please buy this ebook, and at the same time strengthen this channel? It's very cheap. Learn economics through this book, take control of your future, and help others too. The purchase link is https://bit.ly/understanding-economy. As soon as you make the payment, you can instantly download this excellent ebook. A small investment that will transform how you think, act, and thrive. Don't just survive the economy, understand it, and use it to totally benefit you. Could you please buy the ebook, like this video, write your comments, and watch the other videos of this channel? Thank you very much for watching this video.